I'm Karen Clay, and I'm the Disability Outreach Coordinator for Florida Voices for Health. My initial experience with the term fetal alcohol syndrome came years ago. I was in Tallahassee during legislative session at a committee meeting and waiting to speak on one of the bills that they were going to hear that day. And there was another piece of legislation asking for the support and for more funding for fetal alcohol syndrome. And the woman that was giving public comment, my first thought was, just don't drink. It's embarrassing to have that memory, but fast forward to the first conversation that I was on with the FASD group from the Florida Center for Early Childhood. And it was like being hit by a brick. I mean, these foster and adopted parents, they really had the information and explained the difficulties that they were having so succinctly. And much like other parents that aren't given an how-to, when they have their children, the parents of the foster and adopted parents of children with FASD, they have to find out like who the medical professionals are that can help them. And that lack of awareness from not only medical professionals, therapists, who seemingly could learn from the real professionals, and that's the foster and adopted parents. They're the ones that are writing the real manual or book on how to address the needs of their children. The other thing that struck me was the startling statistics, the high percentage of children in foster care who are currently struggling with fetal alcohol spectrum disorder, and the battle that these parents and their children face on a daily basis. Labels that are given to children that don't really fit, but are the only access to some for care. Much like the autism spectrum, FASD is a puzzle. And we here at Florida Voices for Health have been actively engaged in reaching out to our lawmakers, encouraging them to hear from the real experts, the parents, and to pass the necessary legislation to fund research and to also mandate federal funding to states to better assist the families and children to receive the supports and services they need. We are proud to be in this fight with you.
My name is Louisa McQueeney. I am the Program Director at Florida Voices for Health, and part of our mission is to collect and share stories from Floridians who either cannot access health care or cannot find the appropriate care they need. While organizing consumer feedback in the disability community over the last summer, we received a letter from a mother whose children were diagnosed with fetal alcohol spectrum disorder, also known as FASD. She introduced us to the folks at the Florida Center, and a relationship was born. Although we have been working in the disability space for a while, talking to the parents of children suffering from FASD was an eye-opening experience to me. I had no idea what FASD was. I had no idea that most children with FASD come out of foster care. I had no idea how difficult it is for the parents to find trained providers who can correctly diagnose the disorder. I had no idea how hard it is to access services. Florida does not recognize FASD as a disorder in statute, like for instance, autism. Individuals with fetal alcohol spectrum disorder will suffer from the effects of alcohol and other substance use while in utero for their entire life, and treatment can help them live a life to their best potential. I wish more people knew about fetal alcohol spectrum disorder, and I wish, and how many people live with this particular disorder and how much help is needed to that community. We at Florida Voices for Health are very proud to support this community and to see if we can get some legislation in statute that will provide for funding for this community. Thank you.